and get out of your day-to-day consciousness, which gets affected by so many different things. So let's talk about the mouth as a gateway. And that gateway is very interesting. In the center of this slide, you'll see the oral microbiome, what we call the oral microbiota. And what is that connected to? 5 types of cancer, autoimmune and other immunodeficiency disorders, dysregulating your immune system. Your oral microbiome being out of balance causes an inflammation-induced cancer, carcinogenesis, or the propagation of cancer. There's been correlative studies on this that are absolutely indisputable, that an imbalance in the oral microbiome can be connected with inflammation-induced carcinogenesis. Dysregulating your immune system and your oral microbiome being out of balance puts you at risk of serious viruses and bacterial infections, dysregulating the natural God-given ability you have to regulate. So dysregulating the immune system, impaired immune function down here, leading to hematological malignancies, and a hyperactive immune response or inflammatory response. So lots of inflammatory diseases. The number one inflammatory disease very connected to the oral microbiome and your mouth is rheumatoid arthritis, Sjogren's disease, and other issues. So we really need to look at this idea of the connection of your mouth, of your mouth being a gateway to a lot of systemic disease. Let's just talk about gum disease. That's the body's number one source of chronic low-grade inflammation. And so gum disease puts you at risk of all of these different diseases: osteoporosis, stroke, Alzheimer's and dementia, cancer, respiratory disease, heart disease, diabetes, rheumatoid arthritis, which I just mentioned. But let's talk about the difference between men and women. Men, gum disease gives you gum disease is more prevalent in men than women, but women are more prevalent later in life. What does it affect? How about impotence? Chronic low-grade inflammation from gum disease makes you 3 times more likely to be impotent, 14% more likely to develop some of these cancers. We talked about kidney cancer and blood cancers. By the way, those are 2 more to the other 5 that I mentioned. 50%, almost 50% increase in kidney cancer. 54%, actually a study from Harvard University, was men with advanced gum disease. 67% higher incidence of pancreatic cancer. Then you have blood cancers. And there's a direct link between gum disease and the onset of type 2 diabetes in women, puberty and menstruation. And you also get an increased gingivitis due to hormonal imbalances. If you have gum disease, you're more likely to have a preterm baby, which are born with many complications, such as cerebral palsy, preterm babies. Menopause, 86% more likely. There's the big jump from men and women. Women in menopause, 86% more likely to develop gum disease. So I hope this is an eye-opener, but there are thousands and thousands of studies backing this up. So oral health is indeed a key to your longevity. And you have all of these diseases. You know, we used to think gum disease was about tooth loss and bad breath, and decay was, you know, just about pain and other things. But look at lung conditions, strokes, heart disease, mouth cancer, and diabetes. Oral cancer is the 3rd most prevalent cancer, and we'll talk about that a little later on. So improve your oral health, you're going to live longer. You're going to improve your telomeres, your mitochondria, and you're going to live longer. But chronic inflammation, this is a study from 2019, chronic inflammation as a link between periodontitis and cancer. So there's inflammatory mediators produced during gum disease development. which mediates the progression of cancer. And it also can exert an effect directly in transforming cells from normal to anaplastic, or what we call cancer cells or malignant cells. So gum disease, this is from 2015, gum disease bacteria deemed a catalyst for cancer cell growth. So this is very, very real and a major concern. These were some of the cancers I mentioned. Oh, here's gallbladder and melanoma skin cancer. So there's a host of many types of cancer related to gum disease. So how does this happen? How do we go from healthy gums to advanced gum disease? And the answer here is it all starts with the terrain. We used to think that when I was in dental school I started in 1979, 1983, we were taught that there are bacteria that, cause the gum disease. So you got to kill everything. So that's why you had products like Listerine and Colgate Total. That was old science, a germ theory, where the bacteria flies in and sets up shop, and you get this disease, kill it, right? Kind of like I like to say the raid theory of the microbial world. Like, bacteria like cockroaches, spray raid, kill them all. And we really know now that this is about dysbiosis, the progression from health to disease. So what is dysbiosis? It's an imbalance of the bacterial microbial flora. And gum disease was the cover of Time magazine back, easily 18 years ago. And we talked about gum disease and the inflammation and its link to heart attack, cancer, Alzheimer's, and other diseases. We started talking about this back in 2006, 2004, when we were looking at the human microbiome, which you'll probably hear other speakers talk about the human microbiome and its role in basically keeping you alive. And this was a book called Plague Time by Paul Ewald, which was one of the books I read when I did the Harvard Medical School program in complementary medicine. I read this book, which was very interesting because gum disease, by the way, everybody, it doesn't hurt. You don't usually have pain. Your breath starts to smell, your gums bleed, but it doesn't really hurt. So it's really on the level of a stealth infection. And where you want to be is in a state of balance, what we call homeostasis. That's what we want. And we don't want to eradicate the microbiome. That's over here. So you use charcoal, you do oil pulling every day, and you're going to strip the microbiome. Use xylitol, products with xylitol, kill strep mutans bacteria, and they say, oh, that prevents cavities. No, you're killing the microbiome. What you really want to do is you want to promote balance. You don't want to just nuke the scorched earth policy we've had in oral care products. Is terrible. So when you're in balance, you're fine. When the microbiome is very, very thin or stripped, we call that an atrophic biofilm. And that's where you get tooth erosion and tooth sensitivity, and your gums are sensitive. You get lots of canker sores. That's really due to an atrophic biofilm. That's kind of stripping everything using chemical detergent toothpaste, even natural toothpaste with essential oils like clove and peppermint and tea tree oil. Tea tree is a little plant in Australia, but when you put it in toothpaste, it kills everything. And it can even kill your pets. Xylitol can kill your dog. So xylitol is a chemical, a lot of misinformation about xylitol. So, and we'll talk about that a little later. But here you can see that when the microbiome is out of balance in this direction, you get inflammation of the gum and you get this thick, sticky, smelly film on your teeth. So here is a strip microbiome where there's kind of like a desert. This is a scary jungle of lions, tigers, and bears. By the way, some of those lions, tigers, and bears are spirochetes, anaerobic bacteria. So these green and yellow are aerobic, healthy, vibrant, healthy garden. This is full of weeds and garbage and it hasn't been tended to. We'll talk about that in a little bit too. But it's very important for everyone listening to understand the ancient relationship between man and microbe. And it goes back. Microbes covered, the earth was covered with microbial slime before we were even on the earth. And so I'm sorry, yep, go right ahead. I'm sorry for that interruption. I'm actually giving this presentation from the American Airlines Lounge at JFK Airport. At any rate, the relationship between man and microbe goes back to before we were on the planet. What's interesting is that a bacterium is the same shape of a mitochondrion, and they even divide in a similar way. As a matter of fact, there's a verse in all ancient scripture going back to the book of Genesis, chapter 2, verse 7, that said, God took from the dust of the earth. Well, the earth wasn't covered with dust. The earth was covered with microbial slime. And so God really took from the slime of the earth, microbial slime, breathed his spirit in it, and we became mind, body, spirit. If you're a creationist, that's what you believe. If you're an evolutionist, then mitochondria may have evolved from a bacterium. I believe that it was a cosmic event, the creation of man, the first man and the first woman, and we can see many similarities here. So I have these 4 microbiome commandments. I'm not comparing myself to Moses going to the top of the mountain, but the first commandment is everyone should know we're made of microbes. There are 10 times the number of microbes, estimates even higher, some lower, but 10 times the number of microbes than our own human cells. And that these microbes control us. We do not control them. If you go to war with your microbes, you will lose. We've been trying to kill bacteria with antibiotics and microbes with antibiotics for years, and we have lost that war. We now have antibiotic-resistant bacteria, many shapes and forms, some living in and on your bodies, some living in your mouth, and in the environment around us. Everybody's heard of MRSA. It can close a school gymnasium. Well, there's all kinds of MRSA types of antibiotic-resistant bacteria that are in the mouth. I routinely see them when I perform cavitation surgeries and when I extract infected teeth. Often I'll biopsy and I will take a pathology sample of the area and find antibiotic-resistant bacteria. Because if you go to war with your microbes, your microbial flora is very intelligent. They exchange genetic information when they're threatened and under attack. They exchange genetic information. They even vote. It's called quorum sensing, and they flip a pathogenic switch, and that's where good bugs go bad in the mouth. By the way, bacteria are bacteria. They behave good. We call them probiotics when the terrain is balanced. And they behave bad, we call those pathogens when the terrain is out of balance. So to stay healthy, make peace with your microbes. Now, this is another interesting discussion. How do bacteria in the mouth get to the rest of the body? How are pathogenic bacteria in the mouth found in atherosclerotic plaques around the heart? How are they found? The number 1 bacterium in colorectal tumors is Fusobacterium nucleatum, one of the most common bacteria in the mouth. How do they get there? Well, they can go in the bloodstream. If your gums are bleeding, they can go in your bloodstream. But what's interesting, and years ago, we believed that, it's not possible for bacteria to get past the hydrochloric acid in the stomach. Well, we have discovered since the advance of the Human Microbiome Project that bacteria do get past the hydrochloric acid of the stomach. There are bacteria called persisters, and they kind of secrete a shell around their organism, and you have the ability for them. They have taken bacterial plaque off the tusk of a mastodon, frozen in a glacier, put it on a petri dish at body temperature, and you see microbes flourishing and coming to life. So they can withstand some very adverse conditions. So you want to keep, if your mouth is a mess, if your gums are bleeding, if you have this kind of inflammation, you see in the upper left corner in this interproximal area, which is where gum disease often starts, you really want to make sure that that's healthy. If you're pregnant, if you have heart problems, if you have, all kinds of other systemic issues. So we know that the digestive tract is now a transportation system for unhealthy bacteria in the mouth, and so is the bloodstream directly from the soft tissue in the mouth and the periodontal tissue in the mouth. And the interaction between the oral microbiome and the gut is pretty intense. So you have the bacteria from the mouth colonizing in the intestines, persisting there, leading to activation of the intestinal immune system, another really debilitating inflammatory condition, which is related to ulcerative colitis and Crohn's disease. If you have any of those, please see a biologic dentist. Really look at what's going on in the mouth, and I'm going to give you the best ways that you at home can take steps to deal with imbalances in the oral microbiome so that you don't develop these kinds of problems. But the progression of oral bacteria in the gut include Porphyromonas gingivalis, very common pathogen for gum disease. Fusobacterium Nucleatum, oh boy, that is a bad pathogen when it goes from good to bad. So it's kind of like you have bacteria behaving in a nice environment, and then you have the next environment, which I'll show you, is where a good neighborhood goes to a ghetto, and these bacteria express themselves pathogenically. And Klebsiella pneumonia is the one that's most connected to ulcerative colitis and Crohn's. So the microbiome and your immune system is constantly shaping each other, and it has a mutual ambition, aim to thrive. It actually is a key modulator in what we call dysimmune conditions, unbalanced, acquired immune deficiencies like allergy, asthma, autoimmunity. A lot of autoimmune diseases are the result, we're finding now, of an imbalance in the microbiome. We just never knew before. So the stratification of the microbiome and the compartmentalization of your immune system, they work hand in hand. And this is really key. I mean, I had a theory that a lot of people who had gum disease and toxicity in their mouth, they had a harder time recovering from COVID or even recovering at all because their immune system was compromised. So what did we learn? We learned that the immune system in the mouth has to harmonize with the ecology of the commensal bacteria, fungi, and viruses, not just bacteria. It's this complex community of microorganisms. And it is a key role is to help you defend against pathogenic microbes. So your immune system, on one hand, it gets dysregulated by pathogenic microbes, but on the other hand, when it's competent, it defends you against the progression of pathogenic microbes. And here we were talking about Fusobacterium Nucleatum, and it's a community bug turned pathogen, and it's been connected to all of these adverse pregnancy outcomes, including preterm birth, and another one, preeclampsia, lots of studies, GI disorders, like colorectal cancer, inflammatory bowel disease, appendicitis, cardiovascular disease, rheumatoid arthritis, respiratory tract infections, Alzheimer's disease. Fusobacterium nucleatum can really wreak havoc when it is a common benign bacteria in the mouth, and it turns a pathogenic switch when it's out of balance. And how does it get out of balance? We're going to talk about that. So there's a number of ways that we acquire and maintain a normal oral microbiome. And these are the factors. I want everyone to take a look at this, and the factors affecting dysbiosis or imbalance of the oral microbiome and corresponding dysregulation of the immune system. Number one, diet and nutrition. Definitely a major factor is diet and nutrition, toxicity and endotoxin production. From what? Root canals, cavitations, titanium implants. They all produce endotoxins. Sleep apnea, airway health. This is real. This affects 1 billion people on the planet. We're going to talk about this. Harmful oral care products. Pet peeve of mine. I spent 20 years of my professional career developing oral care products that help to balance the oral microbiome. And we'll talk about that as well. Lack of exercise. You wouldn't think about it, but lack of exercise actually can affect dysbiosis of the oral microbiome. You have a sluggish circulatory system, a more compromised immune system. So you really want to produce those short chain fatty acids with exercise, which are anti-inflammatory. Stress. We talked about psycho-emotional issues. We talked about mental, emotional, physical. Stress is very debilitating and dysregulating to your microbiome. Amazing, right? We are mind, body, spirit. They are not independent of each other, everyone. So I encourage everyone, take an inventory of these. Let's talk about diet and nutrition for a minute. Saturated fatty acids and vitamin C. Now, you see some vegan options and you see some non-vegan, like Arctic char and non-farm, and healthy salmon. I'm trying to think of the word. Free deep ocean. But really you want the B vitamins and the vitamin E. By the way, I am a strong supporter of a plant-based diet, but I do not have any opinion about people who need and require and perform better with a keto, paleo diet that is not plant-based. Lots of studies, though, support plant-based as a long-term, healthy, really immune-boosting, longevity-promoting diet. And very, very interesting. Diet and the oral microbiota go hand in hand. Toxicity and endotoxin production. This is a biggie. So jaw cavitations, you may have heard that term thrown around, stealth infections, usually where your wisdom tooth was removed. It's an unhealed hole in the jawbone caused by an extracted tooth or a root canal or an injury to a tooth. It's a silent infection, chronic illness, and chronic inflammation. And I created a very specific protocol to this. And if you want in these, I think we're giving this as a free gift. What are jaw cavitations, why they're significant, and what are the objectives of jaw cavitation surgery. We're going to give you that. And I also have a screening guide for the top 10 sources of chronic inflammation and toxicity. This is a jaw cavitation. So here was a schematic drawing of an extracted, here's the radiogram, here's a schematic drawing of an extracted tooth. Here is when the gum tissue is flat back and it was accessed. It's literally a hole in the jaw. Here's a root canal that was done that most dentists would say, oh, this is a terrible root canal. If the root canal is done well, look, this root canal is done well. And then when you flap it back, you see this cavitation. That's horrific. So often we can't see this type of defect unless you use 3D cone beam because it's superimposed with the tooth. I'm sorry for the gross picture. So the way to see these sources of toxicity, endotoxin production and all, is 3D cone beam is really the gold standard, because an infection like this seen on the side